We go. Hi, Kristy. We are so excited to have you here for our Therapist Thursday for April and OT month. And well, I've known you for quite a while. I want you to introduce who you are and what you're doing, just a general review of your practice right now, and then we'll go into some of the other discussion points lately. But I know you are in Southern California, right?
I am. So I'm Kristy. I've been an OT for 23 years now, which seems wild to say that. Born and raised in Wisconsin, but I've been in Southern California now for probably 50, no, probably closer to 20 years. Um, yeah, and I have a mobile Med B outpatient practice. And so I do a combination of clinical and then the home modifications, home safety assessments.
Hmm. And so, what really is it that inspired you to get into the home mods area as a specialty? What led you down that path?
Well, the majority of my career in the beginning, I worked in SNF, and then from SNF, I was in home health. And when I was in home health, I was running into all of these home safety kind of challenges that I felt like I had just a very kind of bare, basic understanding of what was available and what was out there. And so when I transitioned to my own practice, I knew that one of the challenges, for a lot of families was the home modification and home safety equipment aspect. And I wanted to be able to be a resource to my community and my patients and be able to help them, get answers to all of these questions. And how do we find the right equipment? How do we choose it? Where do we source it from? All of those things.
Yeah, so obviously it grew out of the challenges that you were seeing when you were seeing clients in home health, right? But you've also worked in some other areas. But thinking about when you started to look at home modifications and adding it to your own business, what were some of the hesitations or even some of the misconceptions that you had before you started exploring that further? And then how did those change for you?
I think the misconceptions would be that there maybe weren't answers to every problem. Um, there, there's so much more out there that's available that I just didn't know about. And I think that a lot of, you know, older adults and seniors and family members, they don't know about as well. Um, and my mind went blank. What was the second part?
So it's just like there were misconceptions and hesitations that you had.
Oh, and I think the other part was how can it be provided to people? Like, is it actually covered by Medicare? Are certain things covered by insurance versus private pay? Um, and so actually going through the chat program and working with you helps to clear all of that up for me.
I'm glad that was helpful. Yeah, that was one of my misconceptions too. When, I left being a professor at the university, I was like, oh, this can all be cash pay. And it was like a rude awakening when the chiropractor's wife said to me, you can't do that. So I had to do a lot of research related to that. But the other thing you said about it was learning about all the things that are out there. And I kind of think we get some introductory stuff to home mods when we go through OT school and some exposure. But do you feel like that knowledge has changed a lot since you've started practicing in this area and working with the chat group?
I do, absolutely. I don't, again, I think when I started and when I was in OT school, I think, in terms of DME, it was really limited to what is covered by Medicare, um, which is a very kind of limited, most basic amount or option.
Or not even
Um,
when we talk about Medicare and DME, right?
right. And so I don't think that I was really exposed to it a lot. But over the course of time, learning from other clinicians, finding yourself and this program, going to things like the Abilities Expo really broadens my horizon as to, the different specialty equipment out there and what products, really can maybe be a better fit for certain patients and homes and conditions.
Yeah, that kind of reminds me of one of the clients that I had that was actually developmental disabilities, where the case manager called me and said, "Can you please come in and evaluate this client?" And I was like, "Sure." She said, "Well, the home health OT has been there and told them that what they have is the only solution. That's the Cadillac version." And it was a sliding tub transfer bench. And then realizing what the needs were for this client is so different, right? And to me, that was so rewarding, though, to be able to just give them an answer and make it safe. So tell me about like those most rewarding moments and things that you've had in focusing on home mods, because I know you've been doing this for a little while now.
I have. I would say in general, Um, my neural population probably is the most rewarding just because they're the most complex usually. Um, it has kind of been the experience, that whatever care they had in the home, the recommendations were just a standard, commode or here's a wheelchair, and it wasn't working. And even when you make a recommendation for like a sliding tub transfer bench, there are lots of different sliding tub transfer benches out there. And I found that families were and patients alike were so appreciative to have someone who's knowledgeable, who can come in and say, here's how we can make this work for you and for your family or caregiver so that everyone's, needs are being met as safely as possible. And I think that's the most rewarding part is just how grateful they are to have something that's finally working for them.
I like what you said there about the fact that you're going back and following up after you've made the recommendations, that you're doing training and you're spending time with the caregivers. I hear a lot of people saying they want to get into home mods because it's a one and done. They want to get out of regular clinical care. But it seems like you're saying that that's actually not the best part of it.
No, well, personally, I think that's a disservice to the patient and to the client, and to the family. There's many times where, the things that we say or we may recommend, or even some of the hands-on training that we did, yes, they're kind of return demonstrating it in the moment, but then you leave and they're with the piece of equipment for a week and they're not using it right, or inevitably something comes up. And so I think it's so crucial to be making those follow-up visits and making sure that yes, this is working for the patient and for the family, and if not, being able to problem solve in real time. um, I always follow up, you know, a couple days to a week in person after someone has new equipment. And even if it seems like they have a handhold on it, and even if they say, no, I don't think I need, any more visits, I still do a phone follow up, 2 weeks and then 1 month later. And you would be surprised how many times families or caregivers have additional questions, or, hey, can you come out? This isn't working. We're not so sure what to do. I've had patients in the past that have had even a lot of complex DME delivered that's just sitting in a back room somewhere because no one showed them how to use it. Someone doesn't feel comfortable or safe using it. And so it just sits there. So I think the follow-up piece is so, so important.
And we've spent a bit of time talking about DME, but the same thing goes with architectural changes, right?
Yes.
Or even more so sometimes, because that communicating with the contractor, they don't always have the same vision that you have, even though you try, right?
They don't. And that happened recently. And even though everyone claimed to understand what, you know, what we were trying to achieve, and even with the photos and with the written, and then, there was still a misunderstanding by the contractor.
And that's why, again, I love your approach to making sure you follow up and reach out to the client and family or caregivers. Because, I mean, first of all, I think ethically that's what we should be doing, but it's just the right thing to do. We made those recommendations, and it's also a great learning experience for us, right? It's not the first time I've gone back and realized that I made the wrong recommendation. And that helps me so much more in the next situation, right?
Absolutely. And I'm always learning from my patients and their caregivers and family members, because inevitably what someone is dealing with in the future, I'm going to come across someone else who has the same challenges or the same questions. And it just helps me to be more prepared, to meet their needs, hopefully more efficiently.
Yeah, for sure. Yeah, I just there's so many things that we can learn from how our clients have adapted or even resilience that we can carry on or encourage other clients with as well or ourselves. You mentioned about the chat program and you added that on as you started to build your practice. How did that help you and how useful was that to giving you a basis to doing all these home mods and the assessments?
I mean, for me, it's been a crucial part of feeling confident in the business and really learning um, what can, be billed private pay versus what we can and should be billing Medicare or insurance. Um, and I love the weekly chat grad groups. I mean, it's continuing education. There's always an opportunity to learn. I feel like I have a much broader knowledge of what's available. Having the conversations and learning directly from, um, for example, Dignity Lifts or some of the other manufacturers that have come on so that we can ask, you know, our questions directly to them to help us better serve and make better recommendations for all of our patients. It's priceless.
Yeah, the grad group is a great learning experience for me even with it. But you're right, we're bringing in all the equipment suppliers, specialists in areas of ergonomics or sensory rooms, or our last night's discussion on AI, right?
Yeah. But
How
also
did
the it's such a great group of fellow OTs. Everyone is so willing to help out and try to problem solve, especially when we have our case discussions, which I'm so grateful that we have, because inevitably we're going to come up across something where we just want or need another set of eyes, or
yeah.
a great village to be able to draw from.
Yeah, it is. And everyone brings a different perspective, but a really helpful way to put that in there. And it's interesting how everyone has also developed different niches in their community because their communities are different. And on that score, I want to ask you a little bit about some of the different areas of your community where you're reaching, because I know you've got different payment sources, which is always a question people are asking about, and different referral sources. So I don't want you to reveal, tons of details, but if you want to just kind of broadly talk about the different groups that you're working with and how you're getting paid, briefly, we're not talking about price fixing or numbers here, but just the
Right.
broad perspective, because I know that people here thinking about going into this and you've talked about Medicare, but your practice is broader than that.
It is. I would say it's between Medicare, Medicare Advantage plans, workman's comp, for catastrophic injuries, and private pay.
Hmm.
If I had to put it in buckets, that's where I would put it.
Yes, and potentially now even contracts with other agencies, right?
Yes, potentially that. I learned recently about congregate living health facilities, which I didn't know was a thing. So that may that may develop into something as well. Um, yeah, but those are the different.
Hmm. Yeah, and I know some of your workers' comp claims have taken you a little ways to drive out, or some of the catastrophic injury ones, but those have also been very interesting and challenging. And um I think the Home Safety Pros group, the chat graduate group, has been really helpful with that, right?
Absolutely. Yeah, especially when I saw my first, workers' comp um, patient. I didn't really know what to expect, and it was an experience. It was a challenging experience, but it was a good one, and I learned a lot from it. And everyone in the group, has been so helpful, with sharing their experiences as well. And it just helps us to each, continue to grow.
Yes, and this group that you're talking about is our Home Safety Pros, which is after you graduate from the TAC course. And the therapists are all across the country. So it does bring a large uh, variety of experience and opportunities or payment sources and stuff too, or even just perspectives. Um, One of the things there, if you had to give advice to people who are thinking about moving into home mods or building their own private practice or extending a practice where they're working for someone in home mods, what would be your top 5 pieces of advice?
Ooh, top 5 pieces of advice. I would say just do it. Um, really try to, well, I would say absolutely take the chat course so that you have a really clear picture of um, what you can be billing and how you should be billing for different services, covered versus non-covered. Um, and then really going to networking events and networking with other community-based therapists, case managers, um, senior centers, kind of whoever's in your community. Um, I would say those are probably my biggest pieces of advice.
Yeah, getting to know your community is so important, isn't it?
It
Yeah.
is. And it does, at least for me, it's taken time to kind of get connected to kind of, for lack of a better term, the right people, but the people that are um, in the homes and the ones that are making the referrals.
Yeah, it's interesting because we kind of think we're going to just put our shingle out there, for lack of a better word, and people are going to come, right?
Yeah,
But that's not really how it happens. We have to find those people in the community that are in touch with our clients, but we also have to kind of be able to communicate how we can help them solve the problems that they're facing in servicing our clients as well, right?
absolutely.
Yeah, and that's where your networking, you're talking about the congregational housing, that's where your networking has come to play there, right? Because now they're reaching out to you.
Yeah. It's kind of nice that it's going the other way. Where it's a more reciprocal, collaboration. But I think that's just kind of a testament to, when you do connect with the right people, and they realize the value that you bring and the services that you provide really clearly, um, they're more apt to, reach out and connect you.
Yeah, definitely, of course. And then like you said, it takes time, like any relationship, right? It's learning that trust, learning to know, learning to understand.
Yeah,
Yeah,
definitely.
yeah. One of the things, and I know this came up a bit with a couple of your clients, but just that balancing your clinical judgment and recommendations with the client's personal goals or aesthetics. And I know you've had a couple of challenging clients in this area. In just as there's something that you want to discuss about that.
Um, yes, it takes time and a lot of patience. No, I mean, I would have to say, yeah. How do I say this tactfully?
It's
Yeah,
kind of building that relationship process, though, again, slowly, isn't it?
it is. And really being able to understand kind of what is the barrier to why they're holding back from making the leap to kind of really getting on board with your recommendations. And sometimes it's finances, sometimes it's no lack of finances, sometimes it's, just feeling really overwhelmed or having a hard time accepting the current diagnosis and maybe going through a change with a really chronic condition and accepting that this is not going to get better. And yes, I do need this. I recently had that, very recently, um, with someone who really needed a Hoyer lift. And it took over 2 months before they were really willing to accept that this is the situation and this is where I am. And yes, actually, this does make my life and the life of my caregivers better. And it keeps both of us safe and prevents my caregiver from being injured. So it's definitely um, it is a challenge. But there's also so many more options out there. I mean, we've had different grab bar companies come in, right? It doesn't have to be the traditional looking grab bar.
The chrome one that makes me look like I'm back in the hospital or in the ADA bathroom, right?
Yeah, there are so many more options available that don't have quite that medical look. And again, a lot of people don't know about them. And so when you can educate them and, bring up things you know, on the internet that they can see so they have a visual, it still has taken time, but it kind of helps them to come around a little bit.
Yeah, that also does away with the one and done approach too, right? Because even helping people transition, things change. And you were talking about your clients with neurological conditions. If you think about that, what works today for them may not work in 3 months or in 6 months, right?
Yeah,
So where they understand you're going to be there and they can reach back out to you,
yeah.
that is definitely going to be a key. Um, and
And
I
I
think, yeah, go
do
ahead.
also helping families to understand that some of the equipment that you might be recommending, is going to be essential for the person to have in 3 months, 6 months, because we know what the disease process and, based on what we're seeing clinically, like where this is likely to trend towards. And families and patients, they don't have that insight. Um, and so I think even though it's sometimes hard for families and patients to hear that this is not going to get better, this is, where it's trending. In the end, they really do appreciate that honesty and appreciate having things in place before they really, really desperately need it.
Yeah, that is key. And then I think just again, as we've talked about, even with the community referral sources, thinking about it takes time for them to build that trust in you as well, and understanding that you're there to help them with this process, not just to say, I'm the expert, but that it's a shared decision making.
Absolutely. I kind of always position myself to be, to say I'm here to be a care partner. I'm part of the team. I'm not the only one, The team is me, your physician, you as the patient, whichever family members or caregivers that you want to be involved. Um, yeah.
So, on top of all that, what keeps you wanting to be in this field and wanting to keep learning more about it?
I mean, I just love it. I just absolutely love it. And I know there is such a need, especially in my community. I live in a community that has much older homes and a very aging population. And the homes are not set up for successful aging in place. Um, and so I just want to be a resource and help everyone.
I think it's great to hear that because we hear so much now. And if you're on the internet, you hear about how awful a career this is and how people are burnt out and they're tired of the quotas and the numbers and everything else. Has this changed your perspective about the profession, about occupational therapy out in the community doing home mods?
I mean, I definitely think that there should be more education and training about private practice in school. It certainly was never discussed as an option when I went to OT school. Granted, it's been over 20 years, but it doesn't really sound like that's changed much in the curriculum from the local OT students um, that I've met. And I think there's so much that we as OTs can offer because we're so holistic.
Mhm.
And we really can specialize in a lot of different areas.
Yeah, so this, I mean, to me, working in homes with clients like this just brought back to me why I became an OT, right? It's kind of raw, real OT, isn't it?
Yeah.
Yeah, that PEO, person, environment, occupation. I want to open it up to other attendees. Anyone have other questions for Kristy? I know, Rochelle, you brought up some things earlier. I don't know that we answered all of them. So please feel free to unmute yourself and ask Kristy some questions or make some comments.
Hey there. You answered most of my questions. I guess, how did you get started? Are you a one-woman show or do you have someone helping you with billing? Um, how does that work?
I am a one-woman show and I do all of the billing.
Okay.
Um,
Or reach out to Sue when you have problems.
yes, who's a great resource for billing and Medicare questions as well. Um, but yeah, I am a one-woman show at this point in time. I don't know if that will change, but for now, I'm happy to be a one-woman show.
Okay. And are you, um, I don't want to be like inappropriate asking financial questions, but are you close to an OT salary now, like a home health full-time salary, or are you just starting? I don't know how long you've been at this.
I've been at this about 3 years.
Okay.
Um, I would say that I'm not at a home health salary, but it's because I choose not to be.
Okay.
Um, I think the other great thing about, being in business for yourself is you can choose how busy you want or don't want to be, and you can, kind of choose which cases you do and don't want to take. So for me, that part of that's by choice.
It's good to be able to prioritize what your life values and goals are around all of this, right? And so having your own business gives you some freedom and flexibility to do that. For me, it was when my daughter had a NICU baby and then she had to go back to work. I was able to share the babysitting, with us. And I will never get those hours back again that I was able to flex off my business and take care of this little 2-pounder, you know,
It
that, yeah.
that's so true. I did that for a family member last year, when they were unexpectedly hospitalized, and I was able to kind of put things by the side and be there for 6 or 8 weeks. And had I, not been working for myself, it would have been a much, it probably would have been much harder to do.
Yeah. Jackie, go ahead and unmute yourself and ask your question. Anyone
Oops, sorry
else?
about that. Hi, this my name's Jackie. I'm OT currently working in home health out in Kalamazoo, Michigan. And I was curious, and I missed the first few minutes. So I hopefully you haven't already talked about this, but I was curious, did you start out doing um just kind of OT part B and then evolved and then started adding, kind of the home mods, or did you start off with really wanting to do more of the home mods first?
That's a great question. I would say that it was kind of 50-50. I think I wanted to do more of the home mods initially, but didn't really know how to go about doing it, until I came across Sue and went through her chat program. And that really helped me to solidify how I wanted to incorporate that into my practice. But I also love, treating patients outside of home mods. Um, and so for me, it's kind of a really nice balance. But I probably over time would likely trend to majority of my caseload being home mods and less clinical care. I just don't know when that transition might happen.
Okay. How did you take that leap and get your first patient?
I
As far as for, just
um,
like outpatient part B, how did you take that leap and
well, for me, the leap came from the home health agency that I was working for. Now, granted, I had already gotten credentialed with Medicare to start seeing patients on my own through my own practice, because the home health agency that I had worked for at the time, the census was very inconsistent. And so I was like, well, I have room. There's a need out there. So why don't I, go through the credentialing process and start? And then the home health agency that I was working for, probably 6 or 7 months after I had gone through the credentialing process, they closed the entire home health um, aspect of the hospital.
Hmm.
So they closed their whole program. And so then I just decided, well, I'm just going to stick with it. And I've been doing that ever since.
And for people who are interested, I do have a free flyer that tells you about how to get started with your own private practice.
Mm.
That if you want, you can email me and I will get there. I also do Medicare credentialing if people want to get credentialed with Medicare. So there are all those options that are available for that. I know Jen has a question too. Are you finished, Jackie, or do you have another one?
I'm good, thank you.
Okay, no problem. Jen, why don't you go ahead?
First, thanks so much, Kristy. It's really inspiring and interesting to learn from you. And I guess I have two questions. One I might have already forgotten. One, I think when I saw doing the Medicare patients or home mods as private business, I was wondering, is the rate higher than, say, a pay per visit with a home health? Because I thought to myself, well, if it's the same rate per visit and then I have to do a lot more work with billing and all these things, why would I want to do that unless it was a higher rate? And then I was wondering, I've never heard about workman's comp, so I was just wondering about that and if that's home mods or just clinical treatment. And then the second question was about, do you use a certain software or format or when you do your evaluation?
Okay. I Let's start with the last question first because that's the easiest for me to remember. Um, yes, in terms of documentation, use an EMR called Hello Note. In terms of rates, Medicare Part B, you can Google what the physician fee schedule is. And the rates, depend on where you live. And so you can really kind of figure out for yourself what potential reimbursement looks like. In terms of cost per visit compared to like a traditional home health job, I guess it depends where you live if you're doing, 1099 or W-2. But I would say that at least where I live, it's higher. Billing for myself and doing Medicare Part B versus what I was getting paid per visit. And of course, when you kind of dive into the business side of running things, you look at different things that you can write off in terms of taxes. And so those are all good questions, I think, to think about to really decide for yourself if it is the right move for you. Because it's not the right move for everyone. And I've certainly met people who thought that it was going to be easier or much more straightforward than it was. And they didn't really do a lot of research about, what the process all entails. But that said, with some business coaching and going through, Sue's chat program for home mods, there are definitely ways to make things streamlined and efficient.
Well, in
So
the game, we were talking about more about that last night, even, right? In terms
yeah,
of adding AI support for our services and how to do that.
yeah. And then I'm sorry, you had one more question and I forgot what it was.
Regarding workman's comp and if that's home mods or that's just clinical treatment.
That is home mods. So in my state, I'm not contracted with home mods. The workman's comp, with workman's comp. The workman's comp case managers have reached out, especially when they have a hard time finding someone in there that's in network with them who either can or is willing to do it. And so I never went looking for workman's comp. I didn't really know it was an avenue until I got approached by it.
And I've done several workers' comp catastrophic case management home mods where we've done significant remodels for them. So
you've definitely mentioned it in some of our chat groups, and I think one or two others have mentioned it, but it never really occurred to me that it makes a lot of sense that workman's comp has these needs as well.
And that's where learning your community, but it's also overwhelming to try and take it all on at once, right?
Oh yeah.
Yeah.
Absolutely. Yeah.
Yes. And it's interesting because if you go back and listen to some of our other Therapist Thursdays, we have coders who are running businesses doing this, who are hiring therapists and everything else, and they're generating work within their communities. And it really is understanding where the market is in your community and what's available and networking and connecting with those.
And really figuring out where the gaps are,
Mm-hmm.
the underserviced areas. I find that that's, where I get the most referrals from.
Mm-hmm. And mine started to be the home and community-based waivers as well, which was another area. Does anyone else have questions that they want to ask? Yeah, Jen, go ahead.
One more question I thought of. When you do the home mods for insurance companies, do you find that they approve the recommendations? I was thinking of something where I do like work for a company where they send me out for that. The insurance company asks, and for example, saw these stairs, and I said, yes, they need the stair lift, and then the man later called me and said, no, they wouldn't do it because it was curved. And so I just thought, well, how many times do I recommend these things and then the insurance doesn't approve them anyway? So I was just curious about that. If you ever find out how many things are approved or not approved.
Do you work with the case manager at the insurance company? Like, do you
No,
communicate with them at all?
no, because I guess in this position, they're just asking for somebody to come, that the insurance company asks, is it medically necessary? And they agree to that, but then they just have things they will or won't cover, even if it is medically necessary, I guess.
I think, Kristy, that goes
Interesting.
back to what we were talking about last night about really clearly communicating the risk. And this is where I got Blue Cross Blue Shield to actually put in a ramp for me for a young client who had just been diagnosed with ALS, and it was a 26-inch rise, right? And so what I did was reach out to the case manager and say, look, I know this is not usually something you cover, but here's the risks. His mother is his caregiver. You've just paid for a $26,000 power chair. There's no way that power chair can get in and out. Mom is trying to help him down the stairs. Mom falls, he falls. They're both in a nursing home. They both got, you've got the emergency room, you've got this price, you've got this cost. Here's what it's going to cost you minimum for this versus I want $3,000 in materials for this ramp. And once I had sent her my report with all the details and the pictures in it, she was like, you made it so clear about what the risks were if we didn't do this versus the cost for doing this now. It made financial sense to us. And I think that's why, Kristy, your response was talking to the case manager, right? Who is
Yeah,
the connection there that's making these decisions?
absolutely. And then it also, kind of brings you back to, what kind of a template are you using to document and finding kind of, the keywords that really stick out to insurance companies and case managers when we are making the recommendations. And Sue and the chat group have been really helpful in helping me kind of figure out what kind of a template that I want to use. Now, in terms of, you had asked what percentage of things actually get approved. From the workman's comp side, I never know. And that's the challenging part with workman's comp is that my job is only to go out, do the assessment, and make the report. And they have someone else, go out for follow-up visits. So I never, know from them what is approved and what the patient actually ends up with. I would say for my other patients, I'm lucky enough to live in an area with patients that have financial resources to get kind of whatever they want. And so a lot of them do. So I guess I haven't, beyond the traditional Medicare provided basic DME, I haven't really had to fight too much with secondary insurance or Medi-Cal in terms of like submitting reports to see what they may or may not cover.
Mm-hmm. And from my perspective, my referrals again were for workers' comp were knowing the case managers. And so they actually asked me to go back out after the changes were made and either make a corrections list for the contractor or do training with the clients. And then with my home and community-based waivers, again, the connection was the case managers. And again, they were like, please follow up on this, that includes that. So I think that was the key difference than just the one-off. But sometimes that's how you get started too, right? And develop a relationship and get that piece as you get this one-off and then they see what you can do. But I liked how you said the wording is often what's important. And I think, we were talking about here's the risks as why we're recommending this. It's not we're selling equipment. Here is the rationale for your risk piece and understanding who you're writing it to, right? Or for. If it's an insurance-based thing, there's two issues going on. It's cost benefit analysis. And then for a Medicare Advantage plan, it's often what is the cost benefit analysis versus that this person's going to be changing plans in a year or two, right? And so being able to understand and write your wording towards that, I think is key. And that's what you learned when you were writing your reports, that that we were all going over wording and language in our Home Safety Pros group.
Yeah, and really having to tailor the language to who's the individual that's going to be reading it. They likely don't have, they're likely not a therapist. And so in being able to include links, photos, things that really help to paint the clinical picture as to why we're making the recommendations that we're making, I think has served the reports well.
Yeah, and I think some of that language as well, when we talk about the guidance document versus scope of work, communicating with contractors, again, the same kind of thing, right?
Yeah.
Yes, it's a little harder because they're not even in that medical world, but still it's like, I need this to do this. And, that component. Any more questions? Kristy, you've been a wealth of knowledge here.
My pleasure.
If there are no more questions, if anyone wants a copy of that checklist for getting started, please just email me or reach out to me on Messenger and I'll do that. But for sure, this will be going up on YouTube and will be coming out on our podcast so that you'll be able to go back and listen to the answers and hear Kristy's experience again. And Kristy, thank you so much. And thank you everyone for joining us.
Thank you all for having me. Thanks for all your great questions too.
Great. All right. Well, we'll see you in a month for our next Therapist Thursday.
Okay.
All right. Bye.